welcome. My name is Calliope, and I'm going to be performing your examination today. How are you doing today? I see. I hope by the time you leave this examination, you feel even just the littlest bit better. Now, it looks like we are doing a head, eyes, ears, nose, and throat examination, also known as an HEENT exam. Is that correct? Okay. Any particular reason why you wanted this examination? I don't have anything specific in my notes. So I'm just going to ask a few confirming details. Would you mind just giving me your name and date of birth? Good. And is that your preferred name? And how do you like to be addressed? Wonderful. Now for this examination, it is a quite comprehensive exam from the upper chest up. So we're going to be starting with the scalp. We'll look, of course, at the eyes, ears, nose, and throat. I'm also going to be looking at the skin. I'm going to be looking at the neck as well. If at any point during this examination you feel any pain or any discomfort, please let me know. That is very important. And for this examination, I am going to need to be touching you. Is that okay with you? Do I have your consent to do that? Wonderful. So let's start with the scalp examination. Now, I like to use wooden instruments for this as opposed to disposable plastic or metal. So this is a one-time use comb, but it tends to feel a little more informal and has almost a nicer feel on the scalp. So I'm going to be looking at the scalp and the hair. And I'm going to use this. We have a little tail end that I can use to part the hair. And I may be combing it at times as well. So I'm going to be getting a little closer here. And we can just take a little bit here. Comb that out. Have you had any issues with the scalp or your hair as of late? No, okay. And I want to look at the quality of the hair, its strength, its texture. Get a little bit right in here. And I can just comb some of that. Okay. Is it a bit windy out there? Yeah, there's just a couple of knots. Okay, so the texture is even and what I would expect from your hair. If I take a piece of your hair and try to pull it, it's pretty strong. And as I was combing, I didn't have any little loose bits. So we're probably not dealing with an alopecia of any sort. Do you tend to lose a lot of hair? Okay, good. All right, let's take this and look a bit at the scalp. I'm just going to part the hair, take a little look. Side as well. Okay. Good. And we can look right into the hairline here. Just lift back a little bit and look at the skin here. I'm going to pull that back a bit. Come in right over here. And around the ear. Good. Okay. And then the other side as well. Good. Just comb that back and around the ear. Good. Okay. Let me get this out of your way here and comb that back. Good. Now I'm going to feel around the hair, and if I muss it up, then I'll comb it back again. So let me just feel around. And looking for any lumps or bumps that shouldn't be there, and making sure that the ones that should be there are there. At the back of the head here. Good. Okay. Let me just comb that back again. I was able to mostly get under the hair, so just a little bit of it poofed up a bit when I removed my hands. There. Excellent. If you'll just give me a moment. Okay, now let's take a peek at your eyes. So firstly, I'd like to just get real close and take a look at them. And if you had any issues with your vision or with the eyes themselves rather. Okay. No itching or watering, redness, yellowness, anything like that. No. Okay. Good. And the eyebrows look quite intact, as do the eyelashes. Now I'm going to be pulling up on the eyelids, and I want you to look down. I'll look at the conjunctiva tissue. You could look down. Good. Nice and pink. And I'm going to pull down, and I want you to look up. Look up. Good. Good. Okay, that looks good. Now, I am going to have you do some different eye movements for me. So if you could look up for me. Look up. Good. And if you could look down. Good. Just look down. Down. Good. Can you look over here to this side? Over here. Right over here. And can you look over here? Right over here. Right over here. Okay, and can I have you look right up here? Right up here. Good. And what about down here? Can I have you look right here? Right there. Okay, and what about over here? You look right over here. Good. And what about up here? Can you look up here? Good. And just a couple of repeats. Can I have you look up? Look up. And look down. Look down. Good. And can you look at this side right here? And what about over here? Can you look over here? Good. All right. Let me bring in some light. And this will be quite bright. I apologize. But I'm going to do a couple of tests here. So if you could just look straight ahead, perhaps at my nose here. And I'm going to bring the light in, and we're going to do a swinging light test here. Just go back and forth and see how the pupils react, rather. Not relax, react. Good. Just keep swinging that back and forth. Good. And can you look at the flowers behind me? Good. And can you look at the tip of my finger? Okay. Can you look at the flowers? And look at the tip of my finger. One more time. Look at the flowers. And look at the tip of my finger. Good. And can you just look at the wall behind us here? And the tip of my finger. And look at the wall. Tip of my finger. Look at the wall. And the tip of my finger. Good. Now, I'm going to have you look at my nose here. I'm going to divide your eyes, and I'm going to bring in the light. I just want you to keep looking at my nose, and I'm going to look for what's known as the direct, consensual, consensual response. Good. Just keep looking ahead. Direct. Good. Consensual. 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 Very good. Good. Now we are going to perform a little fundoscopy as well using the ophthalmoscope. So I'm going to look at the back of your eye, known as the fundus of the eye. That's why it's called a fundoscopy. So I am just going to pop on that head. And then we'll take a look at the back of your eye. Now I'm going to take off my glasses for this. And let me just have a little look, make sure lens is correct. There we go. Now I'm going to put my hand on top of your head, and this is to keep me steady so that I don't run into you. I'm going to have you look just straight ahead. So let me put my hand on top of your head, and I'm just going to look around for what's known as the red light reflex. Go, and then we'll come in and just take a peek around the eye. So, looking for the health of the blood vessels. We're looking at the optic disc, a bit at the fovea and the macula. Good. Just looking to make sure that everything looks healthy back here. And then I'm going to do that on the other side here. So let me just look for that red light reflex and then come in real close. And we can see everything we need to behind the eye. There we go. Yes, these look like a couple of very healthy eyes. Macula looks good, and optic nerve. Alright, that all looks pretty good. Now we're going to be moving on to your sinuses and some of the muscles around your face, notably the muscles of mastication, which is your masseter and your temporalis primarily. So I'm going to be pressing in on your sinuses. Let me know if there's any pain or discomfort with these, okay? So I'm going to start here at the frontal sinus, sinus cavity at the forehead, frontal bone. Okay, and now the ethmoid sinus around the ethmoid bone. Any pain or tenderness? Okay, and we have the maxillary sinus around the maxilla. Pretty intuitive where these are. And any pain or discomfort here? No. Now I'm going to be doing some direct percussion on the sinus cavities. Let me know if there's any pain or tenderness. So I'm just going to tap, 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 tap. Tap, 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 tap. Okay. Anything with that? No. Okay, so now let's look at the masseter and the TMJ joint. So right in here, I'm going to do a little bit of palpation. Is there any pain in any of this? Okay, and if I could have you open the jaw and close the jaw. Open, close. Good. And any pain or restriction with that? No. Okay. So now let's look at the temporalis. So I'm going to have you do the same thing. I will have you open the jaw, close the jaw, open and close. Good. And any pain or tenderness with any of that? Wonderful. So let's take a few notes. Good. Now let's look at the nose. So we're going to do a bit of inspection, a tiny bit of palpation. Mostly I'm going to feel around the nares a little bit, if you don't mind. Yeah, just a little bit here. I'm just going to get in here. Any pain or tenderness? No. And along the bridge of the nose. Okay, as I come down. And what about the ball of the nose here? No. Okay. So let's grab the otoscope. I've got a speculum on here already. All ready to go for you. And we'll have another one for the ears. So if I could have you just tip your head up a bit. I'm just going to look inside the nose. I want to look at the health of the septum. I want to see if I can get a little bit of a peek at the turbinates. Looking at the nasal passage. Septum is certainly midline all the way up. There's no perforation. And turbinates look good from what I can see. And the nasal passage itself. There's no redness or irritation. Looks pretty good considering the time of year. Okay, let's take off that speculum. And then we will do a little bit of work with the mouth and the throat. So if I could just have you open your mouth for me. And while I have the speculum off, I'm just going to use a bit of light to take a look. Look at the teeth. Make sure there aren't any caries. Signs of decay. Look at the gums. The mouth is an extraordinarily important part of our health. And funnily enough, life expectancy actually increased quite a bit after dentistry was quite refined and had more of an importance. So what happens with your mouth, it's so close to your brain, right? So it's very important to keep the mouth healthy. And if you could lift up your tongue to the roof of your mouth. Good. Right. And the floor of the mouth looks good, as does the underside of the tongue. tongue. And if I could have you stick out your tongue for me. Okay, we're going to test the hypoglossal nerve a bit. So if you could move it to one side, the other, up, down. Okay, and you can put your tongue back in your mouth. And I'm going to grab a tongue depressor. And we're going to look a little at cranial nerves 9 and 10. So I am just going to depress the tongue. If you could stick your tongue out. Good. And if you could just say ah for me. Very good. Alright, uvula looks good. We're in midline. Now while I'm here, I'm going to check the throat, see if we can see any goofiness with the tonsils, with the throat wall, any cobblestoning, things like that. That all looks pretty good, so go ahead and back out of there. Now, if I could just have you take a dry swallow for me. Okay, it might be a bit difficult, but if you could do the best you can. Okay, good. And was there any pain in any of that? No. Any difficulty? Okay, so no signs of dysphagia. And then we can take a peek at the ears. So I'm going to have an external inspection of the auricle first. So let's start right over here and I'm just going to look at the outer structure of the ear. And most importantly, we're going to look behind the ear. Behind the ear is something we can't normally see ourselves. So this is a place we can get lesions, things of that sort. But the actual skin of the ear, all the tissues here look normal. Not seeing anything, any sort of discharge from the ear canal. So then we can take a little peek at the other side here. And just look at the helix, the lobe, the concha, the inner structure, that bowl-like structure, tragus, antitragus, and then you can just pull that back and look behind the ear as well. Just make sure that this is all clear. Good. That all looks good as well. So let me grab a new speculum and we can do our otoscopy. Just snap that in place. So I'm going to be looking in the ear. I want you to let me know if there's any pain at all, pain or tenderness. I'm going to pull the ear up and back before just inserting the otoscope into the ear canal. And we take a look at the external auditory meatus, however you want to say it. And just looking for any signs of infection, impaction, irritation, things of that sort. And look at the tympanic membrane. release the ear there, and we'll look at the other side. Pull up and back, and then here we go. Okay, so quite a similar story here. Looking for irritation, impaction, infections. The tympanic membrane, we look for bulging, perforation. Look to make sure the color is a pearly gray, that it's somewhat translucent, and we can see the incus, stapes, and the malleus. Look to see that the cone of light is where it's supposed to be. Good. Okay, and then I'm just going to pull up and back and take out the otoscope. Good. So, to test the hearing acuity, I'm going to use a few tuning forks here. We have a whole kit of them, and I like to primarily use these two right here, but we are also going to test the low end as well as the high end of hearing. So let's start with the 256 hertz tuning fork. And sometimes these can be a little difficult to hear. Don't feel like your hearing might be going if you can't quite hear the lowest tone, for example. That tends to be the hardest. Just do the best you can. You hear this? Okay, that's all good. Okay, and that's pretty clear. Then, by far the easiest one is our 512 hertz. Let's go ahead and try this one. Good. Okay. Yeah, that one comes in clear as a bell. Now let's test the low end, and this is going to be the 128 hertz tuning fork. This is very low. Yeah, that one's much easier to strike on the bone. Usually use my wrist, but can get quite bruised. These are, well, they're big pieces of metal. And lastly, at the high end, we have 200 or 2000 rather, 2048. Mm-hmm. And that one, the sound doesn't travel as long. But that's definitely audible. Okay. Well, and you've certainly been able to hear me quite well. You've done everything I've asked you to, haven't asked me to repeat you at all. Or repeat myself, rather. So I think that hearing looks good. And we can take a peek at the skin now. So I'm going to look at the quality of the skin, the texture. So I haven't noticed any areas of redness or hyperpigmentation. I have done some touching on the face and there hasn't been any blooming of red. You haven't had any flushing, so probably not super touch sensitive. And the skin itself doesn't look to have a lot of extra texture rather than the normal skin texture. The skin itself is a very textured thing and makes a lot of sense. It's something that goes through a lot of abuse as well. Okay, on the chin here, this is a common area. It's generally where we have hormonal issues crop up. And across the cheeks here. Okay, and the forehead. Here. No, I'm not noticing anything beyond the ordinary. Looks pretty good. So let's test some of the sensation. I have a cotton bud and I have a toothpick. We're going to test your soft and sharp sensation. This is governed by the trigeminal nerve. So I'm going to be touching either the mandibular, maxillary, or ophthalmic branch of the trigeminal nerve. I just want you to tell me whether you feel a soft touch or a sharp touch. I'm going to test these on your jaw here so you know what they feel like. This is the sharp. And this is the soft. Okay? So just let me know which touch you feel. So we have sharp, 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 soft, 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 sharp, sharp, soft, 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 sharp, 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 soft, did those feel as they should? Did it feel equal on both sides? It did. Very good. And now I'm going to have you do a few different expressions for me. We're going to test the facial nerve. So if you could raise your eyebrows for me and close your eyes real tight. Good. And can you smile real big, showing your teeth? And can you frown? Can't really do that on command. Yeah. And can you puff out your cheeks? Okay, very good. And lastly, I'm just going to have you shrug your shoulders to test the accessory nerve. Okay, just a couple of times, a couple of shrugs. Good, and I'm going to push them down. I want you to push them up against me. Down and push up. Good. And lastly, we're going to look at the neck. So I'm going to have just a little peek. And then we're going to do a little auscultation. I've had the stethoscope around my neck this whole time, but now is its time to shine. Okay, and let me unbury this. I'm just going to listen to the carotid artery on both sides of the neck. We're going to listen for any bruits or audible heart murmurs. So I'm just going to have you take a deep breath in. I'm going to have you hold it while I listen, and then I'll let you exhale. So if you could take a deep breath in for me, and hold. Just listen for a moment. Good, and exhale. And deep breath in. Hold it. Good. And exhale. Good, so no bruits. So I'm going to do a little palpation along the carotid. And we'll just feel that artery there. I'm only going to do it one at a time, otherwise it can get pretty uncomfortable. Next, a very sensitive area for good reason. And the other side here. Good. Good, and if I could just have you take another dry swallow for me, I'm going to be lightly feeling around the front of the neck here. There we go. Just checking the thyroid. And trachea is midline. Good. And now I'm going to feel the lymph nodes. I'm going to start at the back of the head. We're going to end above the clavicle here. So I'm going to come up underneath the hair here and feel the occipital node. And then behind the ears, we have post-auricular, pre-auricular in front of the ears. Get into the parotid gland right here. Okay, and we can come down the neck. We have superficial cervical, deep cervical chain, posterior cervical nodes. And then we have supraclavicular above the clavicle. Okay, the very last thing, I want to test your head range of movement. So if I could have you turn your head to one side and the other, go up and down. And if you could tilt your head to one side and tilt your head to the other side. Any restriction in movement, any pain, anything of the sort? Does anything feel overly stretched? No. Well, then we just had a nice little stretch to wake up the neck and head a bit. You can even roll the shoulders back to complete that. Okay, well, let me take some final notes. Very good. Okay, well, you have any questions for me? No? Alright, well, everything looks good. I didn't see any issues with the head, eyes, ears, nose, or throat, or any of the accompanying areas. So I'm going to sign off. And that will conclude our examination. I'd like to thank you so much for allowing me to perform your examination. I hope you have a whale of a day and a good rest of your night. Thank you. Bye now.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation or a throne wish list for props and equipment. Thank you again, and I hope you have a whale of a day and a good rest of your